Acne is probably the most talked about skin issue these days. Although the most effective treatments are the ones prescribed to you by a dermatologist, I understand that not everybody is able to get in and see a dermatologist in a timely manner. So today in this video, I want to share with you some of my favorite, more readily available and accessible products that hopefully can help you jumpstart your acne treatment. Now, unfortunately, there is no cure of acne because it's really a condition or a disease of what we call the pilosebaceous units of your oil glands. However, it's very much treatable. Don't ever wait on it, especially if you already are seeing scars and a lot of discoloration. Now, when I have a conversation with my acne patients when it comes to treating acne, I always tell them that it's gonna take time. There's no magic overnight. And in fact, you may experience some flare-up of your acne in the beginning before it gets better. And a lot of people call that the purge, but that can happen right in the first month or so. Certain types of acne, like hormonal acne, because we're trying to treat those hormonal flares, it can even take longer, like up to 3 months, which is why often when I see a patient in clinic, I tell them that I don't even want to see you back for 3 months because it can take that long for you to have a noticeable improvement. So when we treat acne, we really want to treat based on the predominant type of acne you have. You have the microcomedone forming the clogged pores, which is blackheads and whiteheads. And then you have the inflammatory papule, which is the zits or the pimple, and then deeper cystic nodules. When you have just kind of clogged pores, those are often best treated with topical treatments. For the most part, most people will have a combination of, for sure, clogged pores, because that's really kind of the heart of acne and what defines what acne really is. And then probably few zits here and there. Now, clogged pores, as I mentioned earlier, are blackheads and whiteheads. And so blackheads or whiteheads are essentially what we call comedones, closed or open comedones. Closed being whiteheads and open being black. The reason blackheads are black is that the pores themselves are open to the air, so the oil and sebum and lipids, when it's exposed to air, becomes oxidized, which is why it looks black. But because that's really kind of the start of acne, those often respond best to topical treatments. So let's talk about some of the commonly found ingredients over the counter that I recommend to my patients to start when they are noticing acne. Benzoyl peroxide, topical retinoids, salicylic acid, sulfur, and to a degree niacinamide. Those are going to be helpful ingredients that you can find over the counter that I recommend individuals with mild, especially comedonal acne, to try. And if you're not getting anywhere or improvement with over-the-counter products, definitely see your dermatologist. Or if you're already having a lot of inflammatory, deeper acne, cystic acne that's painful, leading to discoloration and scarring, then please don't wait on that. I would definitely see a dermatologist because the longer you wait on that, the longer it's going to cause discoloration and scarring. I like to recommend 2 ingredients to everyone for acne, and I like to think of them as the acne dynamic duo, and that is benzoyl peroxide and topical retinoid. Now, not every topical retinoid is created equal. Here, we really want to use Adapalene, which is used to be prescription different, and that is the only one over the counter that's been studied to be effective to fight acne. All of the other cosmeceutical type of retinoids, like your retinol, retinaldehyde, retinol esters, those are really for anti-aging purposes and really have not been well studied and don't really work for acne. Benzoyl peroxide works as an anti-inflammatory, antimicrobial, in some ways mild keratolytic ingredient. It really has been shown in lots of clinical studies when paired with a topical retinoid to really cut down on the inflammatory acne. One of the downsides to benzoyl peroxide is, often it's found in cleansers as well as leave-on treatments. In particular, the leave-on treatments can be very irritating and drying and can bleach fabric, so your towels, your pillowcases, and your t-shirts. Benzoyl peroxide and adapalene is very safe to use together. In fact, there is even a compounded prescription called Epidual that has the 2 formulated together. But I usually don't recommend leave-on benzoyl peroxide because it can be that irritating and most people are not able to tolerate it. So my favorite way of using benzoyl peroxide is actually in a cleanser. And yes, short contact time with a cleanser has been shown to be just as efficacious as a leave-on treatment, but far less irritating and also less likely to cause havoc on your fabric and clothing. My favorite by far has to be the one from Cerave. This is what I use on my skin every night. The Cerave Acne Foaming Cleanser. And this is really well formulated with ceramides. It's a creamy texture. It's not drying, and I literally just leave it on my face after I remove my makeup with my, cleansing balm or cleansing oil, and I leave it on for a couple minutes as I'm brushing my teeth. And then I follow it with my topical retinoid at night. Now, a lot of questions I get is, can you use a benzoyl peroxide cleanser with tretinoin? And my answer is yes, because it's really doing its job when it's contacting your skin. So this is what I love. I recommend for those with more sensitive or dry skin. So those with more oily skin, I recommend the Neutrogena Clear Pore Cleanser. And this is a cleanser and mask in one. You can leave it on a little bit longer, maybe like once a week as a mask treatment. This contains 3.5% benzoyl peroxide. The Cerave contains 4% benzoyl peroxide. And this is a great one. It also has kaolin clay, which helps to kind of soak up some of the excess sebum. Leave it on for a few minutes and then rinse off, or use this like once a week as a deep cleanser mask. If you have body acne, one affordable one, because you do go through them pretty quickly, Clean and Clear, they're 10% benzoyl peroxide. And this is a little bit more affordable than the previous two, and I find on your body, because it's larger surface area, you go through them pretty quickly, so I recommend this one. Now, you probably have heard me mention different percentages of benzoyl peroxide. So what we know is that benzoyl peroxide over the counter, you can find them in 2.5 to up to 10% formulation. They're all effective when it comes to fighting acne, fighting the bacteria. However, higher percentage does cause more irritation. So usually for the face, I recommend like 5% or less, whether it's a cleanser or leave-on treatment. For the body, I find it's a little bit more tolerant of stronger percentage. So the 10% I just recommend for body, back, chest, as well as butt acne. If you're wanting a leave-on benzoyl peroxide to spot treat, one I recommend that I use is the Effaclar Duo from ROCHE-POSAY. This contains 5.5% benzoyl peroxide as well as lipohydroxy acid, which is a salicylic acid derivative, and it's not as irritating. So I definitely just recommend using this once a day, maybe at night, to spot treat as needed. If you cannot tolerate benzoyl peroxide, and some individuals have a hard time using benzoyl peroxide even in a cleanser, then salicylic acid can be a helpful ingredient to help unclog pores and exfoliate. And salicylic acid itself is comedolatic, means it helps to unclog pores. Few, again, I recommend in cleansers because often the short contact time does help and they're going to be far less irritating. Couple ones that I recommend over the counter is one from Neutrogena, their acne wash, and I feel like this is a classic 2% salicylic acid, which is the standard salicylic acid strength over the counter. A great just cleanser to kind of start off your day or use it in the evening. If you have more sensitive skin, one of my favorites I've been using the past month, that is a new launch from CETAPHIL that's actually specially formulated for sensitive skin, is their Gentle Clear line with 2% salicylic acid, but also has licorice as well as green tea to kind of help soothe. And this is reminds me very similar in texture and that creaminess to the Cerave Acne Foaming Cleanser. So great one to consider if you have more sensitive skin. If you are wanting to spot treat, Clean and Clear has one that is pretty affordable. It's 2%. So does Neutrogena. Again, use with caution. And if you are using a topical retinoid already, I would make sure to kind of use one area, test on that first, and see how you respond before you start using it on a regular nightly basis. Now let's talk about Dappling, because that's really going to be the workhorse when it comes to treating acne, as well as helping with acne-related hyperpigmentation, and can over time even help to minimize some of those superficial texture changes that you are getting from your acne. I have the ROCHE-POSAY Adapalene 0.1% gel. Now, how you want to use your topical Adapalene, I always recommend using it at night on clean skin. And you literally just want to dot a pea-size amount to your entire face. So like something like this size, and you can just dot it all over your face, like maybe couple dots across the forehead, couple on the cheeks, nose, and chin, and then put on a moisturizer. If you are new to topical retinoids, you definitely don't want to just hit the ground running and use it every single night, because there will be an adjustment period. We call that retinization, where your skin is getting used to the topical medicine. And what the retinoid is doing is really trying to normalize your skin at that cellular level, help to unclog pores and unclog some of that dead skin buildup. And so you may experience some dryness and flaking, and sometimes may even experience some flare up of acne in the beginning, because literally it's just bringing everything that has been smoldering underneath to the surface at once. A lot of people call that purging. That usually happens within the first couple weeks, no more than a month. Now, how to minimize irritation with topical retinoids? You number one want to limit the use, meaning the amount, but also limit the frequency when you first start off. So consider using it only once or twice a week, and then gradually add in a night or two every week. And I always say over the course of 4 to 6 weeks, try to see if you can work yourself up to using it nightly. 2, there are other ways that you can use your moisturizer to kind of help you increase your tolerance. So washing your face at night, putting on a moisturizer first, let that dry, layer on your Adapalene, and then putting on another moisturizer. So essentially creating a retinoid or Adapalene sandwich can be helpful. Using a moisturizer regardless of your skin type. Even if you have oily skin, use a lighter oil-free formulation, but you are going to want to and need to use a moisturizer. So if you're already on a regimen like benzoyl peroxide and Dappling and want to add in something additional, the 2 most popular ingredients all over social media that I have yet to mention, you're probably wondering about for acne: niacinamide and azelaic acid. And to be honest with you, the reason why I held off on talking about these until the end is really there's very limited data on the efficacy when it comes to over-the-counter products. We have good data for azelaic acid, really regarding the higher percentages that are only available at prescription strength, so 15 to 20%. A lot of really good data on its efficacy. It's one of the only few fairly efficacious ones that is safe to use during pregnancy, helps a lot with hyperpigmentation, and helps with inflammation in those with rosacea. However, 10%, there's really minimal, next to none available, but anecdotally, myself, my patients, and other dermatologists I've seen talk about this, I do believe that the 10% is going to offer some benefits, but we just can't really recommend it as an effective acne regimen just because it has not been studied. Now, when it comes to niacinamide, niacinamide is a great ingredient, wonderful ingredient. It helps to stimulate ceramides, help with fine lines and wrinkles, antioxidant, help with brightening, help with inflammation. It does a lot of things at once, but doesn't really do any one particularly well. And when you look at the studies, when it comes to niacinamide, the true efficacy really is at between 2 to 4%. So not 10%. And in fact, 10% you worry about potentially irritation of the skin. So in a moisturizer, it's great because it helps to soothe, help to repair your skin, and really helps you better tolerate your topical retinoids like Adapalene or benzoyl peroxide, since they're going to be, irritating on your skin. So it can really help you better tolerate your acne treatments. Now, additional things that can be helpful is adding in like a mask treatment, a few times a month or once a week. And here I really like to use sulfur if you can get over that funky, stinky smell. The sulfur is anti-inflammatory and can help with the bacteria load as well. And using it as a mask form, I find that to be a little bit more better tolerated than spot treating, because that sulfur smell can sometimes linger on for a long time. One that I really like and use is the one from GLYTONE. This is their sulfur 4.6% mask that you can use once a week or so as tolerated. It can be irritating, it can be drying, so just proceed with caution. So those are some of my favorite over-the-counter acne treatment. Let me know if you tried any of those and which are your favorites. Comment below. I would love it if you can give this video a thumbs up, and please subscribe to my YouTube channel. You can find more information on my social media accounts, and thank you for watching. I'll see you guys next time.